You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic is the deep plane facelift, how to look years younger, and we're talking about low downtime today. And we have an expert on the topic. He is assistant clinical professor at UCLA, board certified plastic surgeon, Dr. Kenneth Kim. Dr. Kim, welcome to the program.
Nice to see you, Randy.
Now, you brought a lot of photos, but before we get into those photos, first tell us a little bit about your practice for people that don't know your practice. Like, who's the typical patient that's coming in to get facelifting procedures?
So my patients are well informed, and these are patients who do not accept the status quo. So these are patients who want something better than what is typically out there. So they want something with minimal risk of surgery, and while maximizing the benefits of surgery. So I do blepharoplasty, rhinoplasty, facelifts, breast augmentations, breast lift, and tummy tucks. But I do them all while the patient is awake without general anesthesia or IV sedation.
So you do it, okay, so they could have, so the tube, so they don't have general anesthesia, right?
You're right. So they don't have general anesthesia.
But they're numbed up, they don't feel anything.
Right.
Can they also, you could give medications to relax them?
Exactly.
Okay.
So, but the relaxant medication, they're fully still alert. I mean, they know what's going on. This is not sedation. So they're not intubated and they're not sedated.
Okay.
So just using local anesthetic. So the anesthetic is gently administered. So they don't feel the pain, and the surgery is done without putting them under. And the reason why I do that, Randy, is because there are risks of general anesthesia. And some of the risks are blood clots, that if blood clot is significant and then it goes to the lungs, it's called pulmonary embolism.
Yeah.
Otherwise, you could have a heart attack, a stroke, and things in that nature. And also, there are other risks such as memory loss, which people are not aware of. But general anesthesia or IV sedation lasting over 2 hours causes neurons, which are nerve cells, specifically at the hippocampus, which is the memory-forming part of the brain.
Okay.
And so you lose memory. So you increase
Can you get it back?
So you increase the chance of getting dementia. And unfortunately, these neurons at the hippocampus, they don't grow back. So whatever you have, you really have to preserve it. So for that reason, I like to keep them I like to do the surgery without the risk of these
Just
general
completely
anesthesia.
numb.
Completely numb.
Now when
they're
we
comfortable.
say, now we say deep plane facelift, and I've talked to doctors on this topic. They're talking about a 30-day downtime, and you're saying that they could actually take an Uber on their way home. They could even sit up halfway through the surgery. You showed me a video of somebody checking their email. It appeared to be checking their email.
Right.
So this is, and I asked you. I said, look, if I got a facelift from you, I asked you this on the phone. How soon could I go back to work? You said, well, you could probably go, but we'd want you to maybe go, I think you said the next week, but you can go the day after tomorrow.
Sure.
A couple of days.
Sure. Because the surgery is done in such a precise manner that there's minimal bleeding, and the surgery is so precise that there's really no discomfort. So I'll give you an example.
Okay.
So we'll talk about facelift, but let me tell you about breast augmentation, for instance.
Okay.
So typically after breast augmentation, patient is sore, so they can't walk around, they can't move their arms, and they're in pain for many days to a week or even more.
Okay.
Whereas my typical breast augmentation patients will go out to dinner that night. If they want to cook, they could move their arm and they could cook if they want, make dinner for themselves. And the very next day, if they want to go back to work, they can. So now going back to...
So what are you doing differently?
So going back to a facelift.
Okay.
Yeah. So because typical facelift patients who are intubated or who are sedated, after the surgery, they're groggy, they're dizzy, they're nauseous, and they lost a lot of blood, so they're tired. And so, so there's a significant downtime. Whereas the way I do it is that I try to minimize bleeding. And so one is minimizing bleeding, and the other is minimizing trauma. So if you're not bleeding, or you have very little bleeding, and you have very little trauma, then you don't have pain. And so therefore, and because mentally you're alert, after surgery, you get out of the operating table, you change by yourself, and you could walk out by yourself. without any assistance, because just think about it.
And there's very little bruising, you say?
There's very little bruising.
Because the way you are...
Yeah, so let me show you this patient.
All right.
So here's a patient before and after the facelift, and this is 7 days after surgery. So typically, 7 days after surgery, if you're to undergo regular facelift surgery, they'll be bruised up, they'll be swollen, and they wouldn't be able to, as you said, go back to work.
Okay.
Whereas this patient, you could see there's no bruising and no ecchymosis. And
what's that mean?
so it means that the blood vessels have not been ruptured. And it is very, very important not to bleed during surgery. And the reason is for 3 reasons. One is that if you bleed, then it obscures the surgical field for the surgeon. So it's difficult for the surgeon to see exactly what they're doing. Imagine you're driving and you're driving in a blizzard or or heavy fog. It's dangerous. And because the incision comes from the ear, and then you're trying to go forward, right? Because the whole essence of a facelift is you have to release the tissue, and then you want to reposition the face. But what happens if you talk about facelift? People always talk about pulling, and how people say one thing they don't want to look is they don't want to look pulled. And then why are faces being pulled? And the reason is because the incisions here, as you're coming forward and forward and forward, you're hitting these blood vessels. And as you're hitting these blood vessels, the area becomes stained, and then it's hard to see. And then you hit more blood vessels, so it just becomes worse and worse.
So how do you get the pulled look?
So you get the pulled look because the tissues that are medial, more towards the center of the face, are still bound down. They're not fully released. Again, they're fully released because the surgeon has poor visibility, and therefore, only thing they could do is pull. And so when you're pulling sideways, then the jowls are not improved. And so what is really unfortunate is when they look pulled, the jowl is not fully corrected, the nasolabial fold is not corrected, the midface is not elevated. So people are using a lot of fillers or fat grafting at the same time. But what patients really want is they just want the descended tissue, the soft tissue, to go back up.
So are you repositioning tissues to where they used to be? Is that what you're trying to do?
Exactly. Just think about it, Randy, is that gravity takes a toll on our tissue, and our tissue fall, right? And that's how the aging process happens. And so what you really want to do is free up the attachments and then reposition. So if you talk to plastic surgeons, they talk about retaining ligaments and saying that, releasing the retaining ligaments is important. However, just releasing the retaining ligament is not enough, because the tissue that is beyond that is still tethered. And so long as something is held down, then based on physics, if you have a pull, if you have a tension, then there's a counter tension. And that is why a lot of patients, the facelift doesn't last. So if you
because they didn't release these underlying tissues enough?
Fully,
but
right.
Logically, this makes common sense. So why wouldn't every plastic surgeon do it this way? Is it more tedious? It takes longer?
Again, because of bleeding. So if you're bleeding, then you have poor visibility.
Okay.
Right? So you just can't go far because it becomes dangerous.
So you're like doing it with minimal bleeding?
With minimal bleeding, right? Randy, I showed you the videos.
You made me watch that video.
Right? I showed you the videos.
I saw no blood.
No blood. And then the people can come to our website, or if they come to my office, I'll show you the videos. They're also online. So you could see how the surgical field is so clean. And when they're clean, then you see all the vital structures.
So that allows you to do a better
you could fully release, and then you could reposition. And then talk about bleeding. Another aspect of bleeding that's very important is that bleeding causes inflammation. So if you think about it, the red blood cells that are inside the blood vessels, they never leave the blood vessels. It comes in through the arteries, right? And then it comes out through the vein. Right? And then what it does is that it delivers oxygen and nutrients, and it comes out. But however, if you're cutting the blood vessels, then what happens is that the white blood cells has to be activated to take the red blood cells out, right? Because we can't have blood there. And that's why eventually after 2 weeks or even 3 weeks, the bruising, the ecchymosis goes away because the white blood cells have taken them out. But once the white blood cells are activated, that by definition is inflammation. And inflammation is bad because it causes scarring, internal scarring. I'll give you an example.
So that's why that tight look.
Well, I'll give you an example.
Just so I understand this correctly, I mean, that's why they're getting a tight look.
They get a tight look because one is because they're being pulled hard. But what I'm trying to let you know is the feel of the face. So if you look at wrestlers or UFC fighters and look at their ears, they have cauliflower ears. And why is that? And that's because they had bleeding from the trauma of wrestling or from contact sports, and then the red blood cells, and then that created the inflammation. That's what developed the cauliflower ear. Or if you look at burn patients, so they get burned, and then the inflammation occurred, and then the skin becomes very stiff. So if you look at babies, if you feel the baby's face or young people's face, it's very supple. Right? And so you don't want the tissue after the facelift to be stiff. You want it to be nice and supple.
So by going in, meticulously doing this, and you're kind of maneuvering around the blood vessels, you keep that supple feel of a face.
You don't have internal,
is that right?
Exactly. You don't have internal scars.
You teach this, right? All over the world.
Yes, yes, I do.
I mean, you're an assistant clinical professor at UCLA. You teach the deep plane facelift at UCLA.
Yes, I do.
Is that right?
Yes, yes.
You just got back from Korea teaching.
Yeah, I also teach at Seoul National University, which is the #1 university in South Korea. And South Korea is a country where they perform more plastic surgery per capita than any other country in the world. So I think that people are interested in learning how to do deep plane facelift safely.
Is there a lot of lip service, by the way? A lot of guys saying, well, I'm doing deep plane.
Right.
So not all deep plane facelifts are the same.
Exactly.
Obviously.
Because deep plane just means that it is under the muscle layer called the SMAS.
Okay.
And it's just the terminology of what layer you're going. But what is really the key point is the full release. Is full release
of all the underlying tissues.
Of all the underlying tissue to reposition. So we're not talking about pulling. And then just to finish up about the importance of not bleeding. So the third component. So we talked about good proper visualization, right?
For the surgeon.
Okay. And then second is minimizing inflammation, right? And how inflammation is bad for our tissue.
For the healing process.
For the healing process, exactly. But then the third is that you're preventing the red blood cells from doing its job. So the red blood cells can get to the cells through the blood vessels. But if you're cutting the blood vessels, then what happens is that the red blood cells can't get there. It's like you have a supply line and now you have destroyed the roads, so then the supplies can't get to where it needs to go. So the red blood cell's job is to deliver oxygen and nutrients. But if you knocked out these blood vessels, then these people are going to age faster. So the thing that we want is obviously we want to have youthful face and shape, but we also want the quality of the skin and the soft tissue, the fat tissue as well, to be healthy.
So it'll stay supple.
Exactly.
Like a baby.
And healthy. And healthy. So that, because again, it needs a constant source of oxygen and nutrients.
Also, you say that by doing it this way, the facelift lasts longer.
Right.
Because the average facelift deep plane could last 5 or 10 years.
Right. So what's really important is that you are doing the surgery, but quality, if you think about what quality is that quality is something that should last, right?
Okay.
And again, if you're pulling, then just simple law of physics, there's a tension, there's an action, and there's a counteraction.
Okay.
So if something is tethered and you're pulling, it just has to come back down. So whereas if you're releasing everything and there's no tension and you're just repositioning, then only reason why a person would age is just due to natural progression of aging from gravity. That's it. But there's no counter tension.
I want to back up for a second because this before and after photo, this woman looks very natural. She even looks prettier, rested. And this was about 7 days later.
Yes.
Will it get better over time? I mean, is there a little bit of swelling going on or none at all? Because she looks good.
Well, she looks good. Again, is because you're not hitting blood vessels.
I don't think anybody would know that she had anything done.
Right.
I jokingly said to you, I could spot a facelift walking 20 yards away. I mean, I'm looking right at her. Just looks like a younger person.
Right.
And I'm not trying to side with you. I mean, this is good work.
Right. No, thank you, Randy. So that's why the patients who have had surgery with me, facelift with me, or any surgery with me, they will say they don't understand why other people wouldn't do it this way.
And she was able to avoid general anesthesia. With
Right. So
the tube
you
down
right,
there,
exactly.
intubated.
No tubing, no sedation.
So it's much safer by far. Nobody would disagree that it's much safer doing it the way you're doing it.
Right. You
that
take
correct?
you take away all the risk involved with
You have more
anesthesia.
photos. I know you wanted to show me these.
Sure. So this is a patient who have undergone facelift somewhere else prior. She looks tired, and one of her main complaint was that she didn't like the way her facial shape has changed. So she had the jowls that formed, and then also the wrinkles around the neck. And she just felt that her jawline has just gone away. And so what I did is that, again, she had surgery done somewhere else. And so because she has
like an older facelift. She had a facelift many years ago.
Right.
Okay.
So it's important that for these people, you avoid hitting their blood vessels again. So because you really want to preserve their blood vessels as much as possible, right?
So you did a deep plane facelift?
So I did a deep plane facelift, full release.
Wow.
And then now you could see that, especially if you're looking at her from there's a front quarter side, but if you look at her from a quarter view, you could see that her jawline, her shape of her jaw is reshaped. And then the jowls are improved, the neck is improved. And so, she looks much more rested. She does not look like she had a facelift. Again, and she does not look pulled. And the reason is because the tissue has been repositioned. And then again, without damaging the blood vessels. And you could see that there's minimal bruising.
So it's like very little bruising, if any.
I mean, it's hardly noticeable. So the patients will say that they have no bruising. Again, the key is to minimize hitting these blood vessels or damaging the blood vessels.
I think you told me this, but correct me if I'm wrong. You said, and we were on the phone, that the report card of the doctor the next days following is if there's no bruising or very little bruising. It shows that they did a very meticulous job. I'm paraphrasing you now. But is that true? It's kind of like the report card? Lots of bruising, something went wrong?
Well, exactly.
Or technique-driven?
Right, it's very technique-driven because you should avoid these blood vessels, right? Because if you're hitting blood vessels, which is common sense is that you shouldn't be hitting these blood vessels. But if you're hitting these blood vessels, then what else are you hitting?
Okay.
The surgery is not as precise, right? So I use the word ultra precision, right? Because also we talk about pain. And so if you are ultra precise, that means that you're not creating a lot of trauma. And I think what patients think is that, if I go to sleep, if I'm intubated or if I want to go general anesthesia, I just go to sleep and then I wake up and everything is fine.
Yeah.
But it is not. What happens is that research have shown, so they've looked at infants who underwent open heart surgery and then looking at what are the factors that determine one class of infants who survived and then the others who did not. And then when they looked at all the parameters, what they found was that the infants who didn't release a lot of stress hormones are the ones who survived. So what it's telling you is that even though you're under general anesthesia, let's just say you are undergoing general anesthesia, your body is feeling the pain.
So your brain feels it.
Your body feels it. Your body feels it, and your body releases these stress hormones. And these stress hormones are measured. And so that is why after the surgery, you wake up with pain. So typically, anybody who has undergone surgery, what is the first thing that happens when you wake up, besides you being groggy and then dizzy and pain, is that they give you pain medication, and you're sent home with pain medication. And that's why we have a lot of opioid epidemics here as well.
So you don't have to do that with your deep plane facelifts?
Not at all. So patients
Really?
will take, let's just say, Tylenol for just that night, or maybe a couple of days if they so choose to. But there really is so little pain or discomfort because, again, the surgery is so precise. And I think another thing is how do you evaluate your result is, again, not just bruising, but how much discomfort do you have after surgery?
Okay.
Because the whole essence of surgery is you want a surgeon who is as meticulous and does surgery at an ultra precision level so that you only do what you need to do without causing unnecessary trauma.
Now, we talked in the green room, and we've spent, I've taken lots of notes when you're talking, but and correct me if I'm wrong, but your goal is to kind of change the way facelifts are being done, to change the way deep plane facelifts are done.
Yes.
Is that correct?
Yes. Not just
and we talked about even with Tesla, he wanted to re-engineer the combustion engine. He wanted electric cars.
Right.
And you want to kind of change the way facelifts are being done for better results, better downtime, less risk.
Right.
Is that fair to say?
Well, yes. So that's been my goal since training, since even while I was in medical school. So I have done research because I felt that in order to advance surgery, you have to do further research, and from a very microscopic to the macroscopic level. So when I was a medical student at Yale University, I received a Howard Hughes Medical Institute Research Fellowship studying tissue regeneration at a molecular and cellular level. And for people who do not understand Howard Hughes Medical Institute, this is an organization that fund groundbreaking research.
Okay.
And so far there are 30 Nobel Prize winners who are Howard Hughes Fellows. And while I was a resident, I also spent an extra year in Switzerland studying engineering regarding minimally invasive surgery and enhanced visualization.
Is that right?
So because surgery, what you learn in residency is what you're taught. Then there's no progress. So only way you could make progress is from the molecular level understanding to even the instrumentation and the whole system design, so you could change the way you do surgery. And so my goal
to keep the skin good as well.
To keep the skin supple, yes.
Okay.
But also, as I said, is how do we do the surgery without the risk of surgery? So how do we get the most effective surgery and take away the risk of surgery?
Which is the general anesthesia.
Which is the general anesthesia and IV sedation. Because again, if you think about it, our brain was not meant to be shut off.
How old, what are some of your older patients that are getting facelifts? In their 70s, 80s?
So they could be up to their 80s, and also with people with medical conditions. So there are a lot of patients with medical conditions such as diabetes, heart disease, and things of that nature.
Could you be on blood thinners and get this done?
Well, especially for people on blood thinners as well, because you're minimizing hitting blood vessels and minimizing bleeding, right? So these are things that you do have to talk to your cardiologist and then make sure that these are all cleared. Okay. But certainly for people with medical conditions, it is a much safer.
This is ideal.
Right, because we're not changing their body physiology, which means body function, right?
Okay.
So.
Okay, I know you have 2 more photos, so sorry to interrupt, but we have about 2 minutes left.
So here's a patient in her 50s, and then what she didn't like was that she felt that she was losing the shape of her face. She felt that her face was getting full, and it was becoming more wide. So her face was becoming more kind of a square.
All right.
And then she wanted more of that youthful V-shaped back. So what I did for her is that I performed a deep plane facelift, but again, releasing all the tissues as much as possible so that tissues are repositioned, so that she doesn't look pulled.
Natural. Looks
and
good.
She looks natural, and that we gave her the shape that she had before. Gave her the look that she had before.
What was her downtime like?
Same thing. Patients can expect similar downtime. So again, 1 week later, they should have very, very minimal bruising. Or minimal noticeable bruising at all if there's.
So what's it like? Because that's a pretty good result. When they see themselves in the mirror for the first time, what's that like?
I think they're just really
Are they surprised?
pleasantly surprised because there's so little bruising, almost no bruising, and they look natural from the beginning. And so they're not going through. And so what they do is that they send their photos to their friends who have had facelifts before.
Yeah.
And the response, they say they love to get the response back because they're just so shocked how different it is and how good they look. And then another important thing is when they follow their face with their friend's face who has surgery somewhere else, they realize that face looks so much, it maintains that because again, there's no tension. So there's no relapse.
Because you are releasing all of the underlying tissues.
Exactly.
But everybody's releasing underlying tissues. But you say they're not going far enough.
They're not going far enough.
They're not doing all of the underlying tissues release.
Right, exactly. It's still tethered, so they're pulling.
So to reposition tissues up rather than back.
Exactly. To where it used to be. And that's how you get the natural result.
You've seen my face. If you did my deep plane facelift, neck, jowls, everything, do you think I could look about 5-10 years younger? In your opinion?
Yes, of course.
Okay,
Yes.
10 years younger, and I could be back to work next week.
Yes.
On camera, ready to go.
Yes.
And I really would have very minimal bruising.
Well, you saw the photos I've sent you, and you've seen the videos. Yes.
Okay, we're out of time. Final message. Somebody watching this, maybe they're 50 plus, 60 plus, 70 plus, 80 plus. They don't like the way they're aging. And they like what you had to say about the no general anesthesia. Okay. But for whatever reason, they're hesitating. What do you say to them if they're considering a facelift?
Well, I'll say, obviously do your research and just understand that you should expect the most optimal surgery. And what is the most optimal surgery is to take away the risk and maximize the benefit.
Okay.
So take away all the risks that can go wrong, which are the risk of general anesthesia or sedation, and also the risk of surgical error, which comes from improper visualization, again, from bleeding, and also all the trauma that happens. And then the benefit is full release for the facelift so that there's no tension. It's common sense. If you ask even a high school physics student, they'll tell you tension is bad. And so there are certain principles of law of science. And so if you have tension, then you are going to look pulled, you're going to look unnatural, versus if you release it and then you re-drape it, then you'll look smooth and you look as natural, and the result will last as long as possible. So that's what I would say is that, do something that is the most optimal for you.
Lots of information on your YouTube channel. They can see this bloodless surgery or virtually bloodless surgery. They can go to your website with lots of photos and explanation. And I want to thank you for coming on the show.
Oh, thank you, Randy.
It's good stuff. If somebody wants to make an appointment, do they go to the website or just call your office?
They could just call our office.
And they always get to see you on the consult?
Yes.
Okay, good. Dr. Kim, I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.